Hey, I received a really good question regarding how should a woman exercise during her cycle. Many already know that a woman's hormones fluctuate quite a bit during the monthly cycle, and specifically relaxin can be quite high, which is tied into hypermobility of the SI joint, which can lead to low back pain and increase the risk of injury. Now, what can one do about this? Well, if you started your cycle earlier in life, the ages of 9 to 10, individuals like that tend to be more dominant in estrogen. Where if you started your cycle later in life, ages 15 to 16, those individuals tend to be a little bit lower in estrogen levels. Now, this is going to play into maybe when you exercise and how you exercise during your month. So, for the people that started their cycles a little bit earlier in life, on weeks 1 and 4, those are going to be the times when your hormones are going to be the highest. So you're going to be more hypermobile during that time, and the risk of injury could go up. So you're going to want to be doing exercises that are a lot more stable, like deadlifts and like more like strength training type things, and squats and stuff like that. It's probably not the time to see if you can do a single-legged Swiss ball squat or some crazy balance exercise or plyos. And I should also mention for the runners, you may want to stick to weeks 2 and 3, where really you can do almost any exercise during that time. You're going to be fine. But if you're a big time runner and you're trying to run during weeks 1 and 4, and if you're in this category, a lot of times what happens when those hormones raise up, especially if you have a major hormone imbalance, it will deactivate the core, which is the known as the inner unit that stabilizes the whole entire spine. Well, if your spine's not stabilized, then your pelvis is not stabilized, then your knee and hip is not stable. So the chances of ankle injuries and things like that go way up. So if you're going to do a lot of running, do it during weeks 2 and 3. If you're a runner, especially if you're not an athlete. Obviously, if you're an athlete, you're kind of stuck on a schedule. You're going to have to work with what you got. But for those who are just working out, can be a really good guideline to help prevent injury. Now, for the ones who started their cycle a little bit later in life, weeks 1 and 4 are going to be their good weeks. They can really pretty much do whatever they want during that time. The running, the aerobics, um, pretty much any exercise. The weeks they're going to really need to watch out for is weeks 2 and 3. Again, the hormones are going to probably be the highest during that time, and they're going to want to do more stable exercise during that time. I should also mention women tend to have a tendency in the shoulders to be hypermobile, and if you do have an anterior laxity issue, you're going to have to be really careful. Maybe do exercises that will actually protect that as well. So this is just a few tips to kind of give some guidelines in regards to hormones and exercises during the month. If you would want more information about how to train with your specific hormones or advance a comprehensive assessment of your hormones via the Dutch lab, check out the link below. Thanks.